Just a little quick video just to cover the issue of constipation that sort of comes up. And in some cases, it's just simple stuff, maybe just people are just not hydrating enough, or they may be basically not getting enough, salt. They're not putting enough salt, or they're not consuming enough fat. Because if you're, so there can be those sort of factors that can play, but there can be other issues as well, real issues that are causing the sort of constipation. I mean, we know the ones with plants, too many plants can be a problem as well. There's plenty of research there. Paul Mason's actually looked into that and covered, but there can be other issues there. There can be issues like, people having gallbladder issues with gallstones or sludge. That can actually cause, the not enough bile coming in to do the job, and that can create all sorts of conditions. They can range from, candida overgrowth to SIBO, which is the sort of small intestinal bacterial overgrowth. They can also cause, all sorts of other issues with the pancreas as well, because the ducts are connected and they run through the pancreas and connect together and combine to push out all the pancreatic enzymes. So, and talking about pancreatic enzymes, you could have low pancreatic enzymes due to gall. It's usually not so much the stones. It's usually because I'll tell you, if you get stones stuck in the duct, like what happened to my father, you will know. You'll be hospitalized in excruciating pain. But if you've got sludge that is inhibiting the amount of pancreatic enzymes coming through, that can be a problem, which means things don't digest properly. They end up in the gut, they accumulate, they tend to basically ferment, so you'll get some, discomfort and stuff like that. Fermentation, you don't get proper breakdown, and that becomes an issue. So there's a number of things that could be driving it. So let's just sort of cover them. Gallbladder issues is one factor. Poor stomach digestion is another issue. Pancreatic issues, which is low pancreatic enzymes or other things. I mean, even if let's say you've been pre-diabetic before and you've had caused some damage to your pancreas, that could be an issue. There you may have to focus with a supplemental pancreatic supplement. There are a number of supplements that basically you can buy the pancreas, or you can just buy the organ meat itself and just provide the nutrients that the body needs to heal that organ. If you're not in the organ, get it in the supplemental form. There could be methylation issues as well. So that's other issues. Microbiome issues are a big one, and it's usually candida. Candida is a bit of a funny thing. It can actually some people can cause, quite a bit of diarrhea, and other people can cause constipation, or can cause both. So when it goes from a yeast form to a fungus form, and it really overgrows, and it really takes off in most cases when people have had a lot of bouts of antibiotics, or they've been consuming those beautiful non-organic veggies full of glyphosate, a well-known and patented antibiotic that really stuffs up your gut microbiome and allows these sort of fungal infections to take root. So that could be also an issue. And that also, when you've got that sort of state of affairs, when you've lost a lot of the lactobacillus type of, which actually help in properly digesting and moving, waste products, then you're going to have problems as well. So it could be an imbalance in your gut microbiome. It could be the loss of those beneficial bacteria due to antibiotics or glyphosate. So there are also some medications that can cause issues. There's things like the pill. I'm trying to remember now. Yes, there's things of that sort, certain medications and some other things as well. Anyway, there are certain supplements that can like creatine. If you do excessive creatine loading, some people, depending on the gut microbiome, can be susceptible to a bit of constipation. But usually when you take it out and stop it, it goes away. So then it's just a supplement. You're putting too much too fast, and your gut microbiome isn't may have some issues as well. So that could be an issue if you're doing something like that, and then you get constipation when you didn't have before. That could be an issue. Then there's the dairy side in some people, which have got low lactobacillus colonies. That's usually, again, a consequence of overuse of antibiotics or glyphosate, where you lose, because the lactobacillus type bacteria do alter the pH in the gut, and also help with the actual improving peristalsis, which is the actual gut, to do the muscle of the gut to actually move things along, in a sense. So those are the sort of things you're looking. And there are also those sort of rare cases where people have sustained injuries due to motor vehicle accidents or other things like that, where they could have injured their gut, cause some injury to the gut. So there can be a number of issues, and sometimes, because there are so many potential causes beyond the standard, you're dehydrated, you're not getting enough salt, you're basically those sort of general things. And usually the sort of Band-Aid solution that everybody throws out there on the YouTube is basically, it's a thing that, the reason why I'm doing this is because Kitty brought it up and actually asked me and said, all they do is they basically recommend a Band-Aid solution of magnesium. And yes, magnesium can loosen the stools and can move, but it doesn't fix the underlying issue. And the underlying issue is that you've got a sluggish bowel movements, and that could be for a number of reasons. We're talking about issues of bacterial issues, imbalances. We're talking about candida. We're talking about injury, and we're talking about a number of other factors like the stomach, pancreas, liver nexus. When I say liver, I include in there the gallbladder as well. So there could be those sort of causal, or one of them, or all of them, driving some of these conditions, and driving some of the other stuff as well. And depending on what your past diet was, you may have underlying problems that you brought over but have never been resolved properly, because you haven't resolved the gut microbiome issues and all that were damaged before. So there are, just because you go on a carnivore diet, it doesn't mean that automatically that carnivore diet is going to basically bring in the beneficial bacteria, especially if you're not doing fermented type, high meats and stuff like that most people don't do, to bring back some of the beneficial bacteria. So, or kefirs and stuff like that. So generally speaking, but then again, there's a bit of a competition in there. If you've got SIBO, if you've got basically candida, there can be a bit of competition there, and they may need to be resolved as well, those conditions, before you can make a bit of traction. But obviously, fixing in particular things like bile flow, normal bile flow, pancreatic enzymes, and stomach functioning usually resolve a lot of these problems in the long run. So those are the sort of things you really have to focus on and look at. I will be making some videos on those particular areas, like gallbladder issues, candida issues, and all these sort of things, and looking at a number of the factors that are at play and how to resolve these. They are coming, but this is just to cover and provide a general overview scope in that regard. Now, let me just click on the share button. Give me a sec. Now, stop doing that. Screen 2. Okay. Now, on the gut microbiome side, which is really important, gut microbiome disturbances are really important. As you know, the lactobacillus type strains, I've already shown in my other stuff, do effectively fight candida, do effectively fight the sort of pathogenic type of bacteria, so they do give them a bit of a whipping, so to speak, which is important. But there are also some beneficial bacteria that can be part of the SIBO condition. And there you're looking at things like actual getting the gallbladder to function properly and the bile to cleanse the small intestine as well. So there are other factors, but we'll just cover this specifically. This is part of that strain that we were talking about. There's an actual study here, and they basically just cover about that, there's growing interest, blah, blah, in using Lactobacillus reuteri on bowel movement frequency. So there is growing interest for the use of probiotics for chronic constipation. A recent randomized controlled trial showed a positive effect of Lactobacillus reuteri on the bowel movement frequency in infants with chronic constipation. The aim of the present study was to evaluate the effects of L. reuteri in adult patients with functional constipation. So they're referring to the old study. I have seen that, but that's not what we're going to cover today. We're going to cover the adult, this one. So this is actually a double-blind placebo, RCT, conducted in 40 adults. And there were 18 males, 22 females, plus or minus 15 years, around about 35 years of age on average, affected by functional constipation according to the Rome 3 criteria. I'm not going to go into that. It's a whole little, it's too much details to go. It would take hours to go through the criteria. Anybody wants to go and see it, they can go and see it and check it. They can just Google it. Let's move on. Patients were randomly assigned to receive a supplementation of L. reuteri, and that is the DSM 17938, which is the one I've been doing the videos about. It's one of the two strains. It's the one. This is also the main strain, which is 3 times more effective against pathogens as well. So I think it's dealing with the pathogens and dealing with a number of those underlying conditions and pushing those pathways. The increase or matching placebo for 4 weeks. The increase of bowel movements week was primary outcome, while the improvements of stool consistency was a secondary outcome. So they looked at the actual movement of shit through the bowel, and they basically looked at the improvements or not in the stool consistency as a secondary thing. Now, oops, please unselect. Results at week 4, the mean increase in bowel movement week was 2.6 standard deviation, and compared to 1, which was at the beginning of the 4 weeks. And so there was an increase in that group quite a bit. Anyway, we'll go back and I'll actually show that part. Okay, and in the L. reuteri group, 1 anyway, in the placebo. So they're just putting there a bit of some of the statistics, which we're not going to. The treatment, the mean bowel movement week was 5.28 plus or minus 0.93. The Rucheri, 3.89, and 1 plus or minus 1.7 in the placebo group. There was not significant difference in stool consistency between the two groups, and that's true. So basically, if your stool was a certain type, whether it's a hard stool, soft stool, or watery stool, there are other factors that, these people's diets and a whole lot of other things why they may have a more looser stools or not. They may be supplementing additional, magnesium, who knows what they're doing. They weren't looking at what the people were eating or their lifestyle. They were just looking at to see what effect would have on these two. And they noticed when it comes to the stool consistency, zilch difference, which we expected. But in terms of motility, movement, there was significant difference. And that's the important thing in terms of the patient. And we've seen this like kids. They actually do it in hospitals. They use this for that purpose. So we know it works in confirm it in adults. Okay, that's the difference. But I see why we work in adults, since we're all human. I don't think we're not human when we were born. It'd be funny, wouldn't it? Anyway. So L-Reuteri is more effective than placebo in improving bowel movement frequency in adult patients with functional constipation or previously demonstrated in children, as previously demonstrated in children, which was the other study that I talked about, even if it seems to have no effect on stool consistency. And that is true. And why should it? There are other factors that are affecting lifestyle, blah, 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 genetics, certain types of genetics. I've got one genetic that doesn't give me loose stools when I get a really viral cold or whatever like that, which is quite nasty. It's one of those viruses, norovirus. So I've got a genetic SNP. Yes, lovely, isn't it? But I can tell you, since I've been on a more carnivorous diet and some of these other things, it's less of a problem than it's been in the past when I get colds or stuff like that. Sometimes I don't get anything now, which is good. Thank the fuck for that. So yes, I've had fun in the past. Let's put it that way. Okay. Oops. Let's go down here and look at this. So stool consistency, basically hard or soft, hard or normal, in terms of hard, normal, or watery, not much of a difference, as you can see. Let me zoom in a bit. So these are stool consistency between, 0 and basically 4 weeks. So we're not seeing some massive stuff here in that regard. So to be expected. Now, when we're looking at this mean increase of bowel movement, this is the stuff we're interested in. So the placebo is at 1, obviously. And here we've got a 2.6 fold. So we've basically nearly tripled the actual movement of stool. That's a pretty much significant increase in a randomized controlled trial. So it's pretty good in that regard. And in terms of the frequency of bowel movements, at the beginning of the study, the people that were randomly selected, they had better bowel movement compared to the people who were on the actual supplement at the beginning. But at the end, those guys on the supplement did better, even though they were in worse, you know. So much better improvements in the amount of bowel movements so you can see that it actually does help. Obviously, if there are, as I said, if there are gallbladder issues, there are pancreas issues, or a whole lot of other underlying issues, we may need to address those as well. So you may need to basically take something like bile, some pancreatic enzymes, and things like that to basically just help the whole thing along. Mercola has actually a supplement that actually includes bile salts and the enzymes, the lipase, amylase, so protease, all the actual ones that cover the key 3 macronutrients. So that's an option for people to look at, but first of all, you need to work out whether that is an issue, whether you've got a gallbladder issue or whether you've got, a pancreas issue or whatever. Usually, if you've got a gallbladder issue, it does affect the pancreas, especially if you've got sludge. But you won't know unless you test. A bit of a giveaway is on your on the side that where your liver is. If you feel discomfort there now and then, and when you put your hand under the rib cage and sort of massage it, it loosens it up and actually makes it less discomfort. Well, that usually tells you that it's gallbladder issue. If you've got a bit of pancreas as well, it usually you'll get a bit of discomfort there as well when you eat. Sometimes you may get that there initially. I used to. So that is a bit of a giveaway as well. So you basically need to sort of work that out and also go and get tested. I can't, from via the YouTube world, come into your world and actually analyze you. That's not physically possible. So you will have to check that with your doctor. And once you've sorted that out, you may want to actually show this study to your doctor and say, well, give this a go, this thing, and then when I do my protocol on the other stuff, you can look at that sort of stuff as well. As I said, this isn't medical advice. It's just showing the research, and it's up to you how you apply that research, not for me. This is the product that has the that strain in a very good amount. Oops, details, wrong one. The dose. Where was the details? That's right, 200 million, and it's 100 million in each one of them. And it's a chewable thing, so it's very easy for anyone to take, a child, somebody who's an adult that may have difficulty swallowing or whatever. So very useful, very easy supplement to use. They do have a page here on constipation, on functional adult constipation, about 25% of the world's population. They sort of discuss some information about dehydration, lack of adequate hydration, not enough fiber, which is complete and utter bullshit. We know that. So there is a bit of nonsense here, but that's a standard sort of nonsense that we get. But this is an important thing where they talk about the role of gut bacteria in constipation. The bacteria in the gut and our microbiota may play crucial roles in the health of the digestive system. The gut bacteria produce substances called lactate and short-chain fatty acids that change the pH acid level of the intestine. This can increase peristalsis, a wave-like muscular contraction that move food through the intestine. reduce transit time and improve stool frequency. Dysbiosis, which is an imbalanced gut microbiota, contributes to constipation. And there's plenty of research to show that, where I've just touched on the edge of that. I don't need to read the rest. It just talks about reduced methane production and blah, blah, blah. Obviously, bloating and all those things. We know all that. But the importance is to understand that there can be a number of drivers that are driving constipation. Sometimes we get fixated and rather than actually investigating these things, we go, I'll just take the magnesium, the Band-Aid solution, and won't worry about the problem. But that underlying problem, if it's a gallbladder issue, can cause problems with your pancreas. And your pancreas, you really need it into old age. You don't want it basically getting damaged. You don't want basically your gallbladder not operating properly, because that can actually have negative effects on the health of your liver. So you can't neglect these things, and you can't just basically, deal with a problem in the Band-Aid solution, which typically medicine uses nowadays. So doctors will give you a drug. Naturopathic doctors, NDs, will give you a magnesium supplementation. They neither are real options. Short term, yes, are fine, but long term, you really have to resolve the issues that are causing it. Anyway, I hope I've given you a bit of an overview, things to investigate, and in down the track, in the not too distant future, there'll be some videos covering these specific areas and how to deal with them. So if they are part of the driving mechanism for your constipation in particular. Anyway, hope you enjoyed it. See yous.